It is an alarming milestone for the United States.
The CDC reports more than 100,000 people died from an overdose from April 2020 to April 2021. That's a nearly 30% increase from the same time a year before. In Kentucky, overdose deaths jumped 54%. Phil Pendleton talked to a couple of organizations focused on prevention and recovery here in the Commonwealth.
In a one-year period, not long after the pandemic started, Kentucky saw its overdose rate jump 54%.
Just makes you sick to your stomach, makes you angry, because this is such a preventable disease.
Nancy Hale is the president of Operation Unite, a drug treatment, education, and enforcement organization. Her nephew was one of those who died, and like so many others, fentanyl gets a lot of the blame.
He thought that he was going to be using Percocet 30, and instead it was laced with fentanyl, and it took his life immediately.
The drug is being blamed for the sharp increase in deaths. Kentucky experienced 800 more overdose deaths from April 2020 to April of this year than it saw in the previous year.
And one of the things I know for sure is there's never been a more deadly time in the history of society for someone to be in addiction.
Brown is with Addiction Recovery Care and says the good news is that there is a solution.
I believe we know what works. We know that immediate access to individualized treatment works.
Sometimes I feel like now, because of fentanyl, that our backs are against the wall again. And we've forgotten about the prevention piece. And so we need to get that horse back in front of the cart.
Hale says Operation Unite focused on prevention 18 years ago and needs to do so again. Phil Pendleton, the Fox 56 10 o'clock news.
According to the CDC report, Kentucky had the third highest rise in the nation, only trailing Vermont and West Virginia.